Welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rady Rahban, and as always, we have a spectacular episode for you. But today's episode is extra special because I am joined by my dear friend, Asaf. Asaf.
Hi.
Shalom, Chaver.
Shalom.
Welcome to the show. Asaf and I, and as we're going to tell you, have a very long, very meaningful story. We're going to talk about how we met, and the premise of today's episode is about nasal trauma, breaking your nose. Now, when we talk about Asaf's story, it'll be just a little bit more than just breaking your nose, but the idea is we get calls all the time, probably once a week. Obviously, I do a lot of nose jobs, so because I do a lot of noses, people automatically, when they break their nose, they're going to call a nose surgeon, right? So we get a call once a week that says, hey, oh my God, my son was playing basketball, someone elbowed him. I was walking and I slipped and hit my face. I think I broke my nose. What do I do? So we're going to talk about noses, but through our story, because our story is one that is quite a spectacular story, and it will set the tone for noses. So, Asaf.
Yes.
Welcome to the show.
Thank you so much. Thank you for having me.
All right. So, Asaf, tell me, and I know you and I have told the story almost 1,000 times, so 1,001 times. Take us to the day we met and the story behind it.
I'll take you back to the day of how we met.
Yeah.
So it was a regular day. I'm going to make it a little dramatic because for me it was very dramatic, and also I can only tell stories in a very dramatic way.
No, but this is actually, with all fairness, this whole thing is very dramatic. You always say, I'm going to tell. It's
very dramatic, but sometimes, like you said, when you tell it 1,000 times,
yes,
so it sounds like you're telling someone else's story, but it happened to me.
Yeah, I promise you it's not embellishing. I was there, so go ahead.
So it was a Monday night. It was late in the evening, probably 7 or 8 p.m., and I went to the gym. Regular training, and I went with my trainer. Did my routine, lifting, feeling strong, and at one point I'm doing bar lift. So
you're on the bench.
I'm on the bench, lifting the bar, I'm on my back, and I'm doing probably around 160, 155 pounds.
Yeah.
Heavy, right?
Yeah.
I think I was a little stronger then and younger. And so I was on my back and I'm lifting and doing the first round. I can do it. Second one, still there. On the third one, after a couple of times, I'm stuck, so you're on your back. The bar is here, 160 pounds. Okay, so what do? You ask your trainer, right, to lift it up. Do your job. It's very basic. I cannot do it anymore. I'm stuck. Take the bars and put them back on the little hooks.
Yeah.
Comes behind me. He lifts the bar, but he forgot to do one thing, to put it back on the hooks, and it dropped. It drops from his hands on my face.
Yeah. I think it's pretty safe to say you're not dramatizing this one.
Yeah, I'm not. I'm actually not.
Yeah.
Fell on my face. Funny, I never been to knock on. This is real wood, right?
Yeah,
I know you. It's real wood. It's not fake. And I never been to an accident. So for me, I didn't feel anything in the beginning.
Yeah. Sure.
I was in shock. It's the gym. There are mirrors, and I could feel that I got hit really badly in my face. You don't know what's happening.
Sure.
I stood up. It's a gym, mirrors everywhere, and I'm like, in cartoons when the blood is coming from everywhere, I'm like, what just happened? My face is crashed. I got the bar here.
Right. Smack dab on the bridge of your nose.
Which is, I think I'm lucky, right? If I got it here, it's...
Yeah, no, I mean, if it would have hit you between your eyes, up here, it would have been... It's bad no matter what. I mean, you're unluckily lucky. So.
I'm unluckily lucky. So I'm standing, I'm seeing myself. It was a gay gym.
Yeah.
So I it's been dramatized even.
Yeah, well, I can only imagine all the screaming.
Exactly. I started screaming. Why did you do this? I didn't know what happened, but the first sentences were, why did you do it to me? Why did you do it to me? Why? I feel no pain, just like trauma.
Right.
Everybody's around me, for real, screaming.
Yeah, I mean, shock and horror.
And in one point, I managed to walk to the main office. And then I think I fainted. I was on the floor and I was like, then the pain started.
So they obviously rushed you, right? They took you. At that point, things are kind of a big blur until we reunite.
Exactly.
Right?
So we reunite.
Until we meet.
Until we meet.
It's like all I remember is Jim, Cedars-Sinai Medical Center.
And I assume there was an ambulance in between.
You're either in a cart or something. Exactly. You got to the hospital.
I remember a lot of pain, like pain. I was waiting outside. And I remember in one point, opening my eyes, I guess in an ER or some kind of emergency room. Yeah. And I see a Persian face looking at me.
Have I gone to hell?
Where am I? Is it hell or is it heaven?
What's going on? Why is this guy here?
Yes, I'm like, and literally, this is the first time we met.
Yes.
I'm like this, my face is shattered, blood, pain, and it's you.
Yeah, and the thing about it is, I was at home, I think it was like 10 p.m., and I was on call at Cedars-Sinai, and it was in my early years of my practice, and I would get called. I mean, I took ER call with all fairness because I had to. Like, nobody really wants to take ER call. It's great work, you do good, but it's like, it's always inconvenient. And most of the people are like uninsured, they're homeless, they're drug addicts, they have hepatitis, they have a swastika on their chest. Like, it's never a good, but Cedars, it's like homeless, celebrity. Homeless, celebrity. Homeless, celebrity. So you were the celebrity.
Okay. Am I the homeless or my?
So I'm at home, and whenever I get paged, I would like have like this Pavlovian response. It's like, fuck, what now? And it's almost always something ridiculous that I don't need to be doing. So they call me, and I remember, and they're like, hi, Dr. Rahban, this is Dr. Smith at the ER. I was like, yes, how can I help you? Like, we have a patient who sustained a nasal, and he hesitated because he was trying to find the right word. And I think he said something like laceration or something like that. And I was like, the ER is notorious for not wanting to sew up lacerations. So then they call the surgeon on call and bring the plastic surgeon in for something totally frivolous that they could have repaired themselves. Like, you're goddamn asleep. Don't bring my ass in to sew something you can sew. He's like, I'm like, well, I think you could probably manage it. You may want to just call me. He's like, no, I think this one's pretty bad.
So I never heard your side of the story. Yeah. I'm like fascinated to know what happened.
So I was like, okay, all right. So at the time I was living not too far from Cedars, and so I threw on my scrubs and my jacket, and I remember pulling up and grabbing my badge, opening the thing. I got in there and I went to the ER, and I'd done this 1,000 times. And I was like, and I went up to the front. I was like, okay, Asaf, room 12, whatever. So I walk in, and your friend, what was her name?
Chrissy.
Yeah. She was pacing back and forth outside, and she's also very dramatic. It's good to have dramatic friends around you.
Usually that's what I have.
Yeah. So I remember her, and she's like, oh my God, doctor, you're here. I was like...
By the way, we waited a lot of time outside for you to arrive.
Not for me, for them.
For
them, that was just to get you into the room. Well, from the moment they call me to me getting you, it's probably 20, 30 minutes.
For me, time felt like weeks and weeks.
Of course, but that's, look, you go to the ER, they're not going to take you back for a good 2 hours. So I walk up, and you were there, laying there, and you had a big old towel over your face. And I walk up, and I'm like, hello? You're like, and you had the towel, and you're like, doctor! I remember.
I'm glad that you find it funny.
Yeah. Well, I mean, it's funny now. You're sitting in the chair here, right? Yeah. Like, you have to be able to laugh about it, right? Yeah.
Doctor.
And I was like, yes, I'm here to help you. And I remember removing the towel. And you had a pretty bad laceration.
It was bad.
Yeah, your nose was pretty crushed.
I wasn't only dramatic.
No, I never said you were dramatic. You are dramatic, but this was not dramatic.
Okay.
So I was like, okay, give me a second here. So I was like trying to figure out, okay. So this leads us to our conversation of today's topic, which is nasal trauma, nasal fractures. I started with your story because A, it's a great story because it's how we became very dear friends. B, it's the most dramatic nasal fracture, and it's not normally what people undergo, but it encompasses what the objectives are. So in your instance, a nose is made up of skin, bone, and cartilage. That's the whole nose. And in your instance, all the layers had been crushed and things were in places they'd not be, and there was a laceration through and through and all these other things. The normal nose injury is not that way. So after a period of time, I was like, all right, well, we're going to have to operate on you. Operate? I'm like, yes, we have to put you back together. Like, this is not something. And I'm a county trained guy. So I trained at USC. I can do 90% of things under some numbing medicine there in the emergency room. Like, I can pretty much do a nose job under numbing. But your case was pretty severe. And so I was like, we need to go and we need to fix it.
You're bringing me back for real.
Yeah. So you're like, and obviously you were panicked, understandably, and you really didn't have a good comprehension of the extent of the damage. And more importantly, it's not because you're gay and you're vain. You're a person. Your face was just crushed. This has happened to me. I've taken care of probably maybe a dozen people in my career where they had major trauma to their face. It's the most devastating thing because you don't know if you'll ever look normal again, right? And in that moment, it's just devastating. So nevertheless, long story short, we take you to the operating room, spend several hours, do our very best to...
You skipped the part when you were very tough on me.
Oh, yeah, okay.
Oh, yeah.
Okay, why don't you tell that part?
He likes to skip this. I was, as you said,
you were a little hysterical. Yes, but that's okay.
With a lot of pain. It's like you said, it's a combination of the pain and how will I look?
Hysteria.
I have no nose. My nose is...
Yeah. It's a totally normal reaction given the circumstances.
And I was... It's like in comedies, when someone comes and gives you
Slaps.
a
It's
slap.
like Airplane.
Step out of it. Step out of it. I don't know what movie there is.
Airplane. It's
Airplane, right. Step out of it. So you didn't give me the slap, but you knew I was Israeli, and you said, okay, I'm going to help you, but you're Israeli, you've been to wars, you've been to everything. Be strong. I think you even say, shut up.
I'm sure. No, I probably did.
Because I would, what's going on? I couldn't control myself.
So, listen, you were hysterical, understandably, and I needed to get you to a place of, I don't want to say calm, but I wanted to get you to a place where we can move forward. I can't operate on you without your consent. I needed you to be on board. I needed you to agree, and I needed you to have faith. And you don't know me.
Yeah.
Right? So that's very important for you to understand.
100%.
Everybody else listening, I want you to understand. If any of you have ever had surgery, 99% of people who are listening who had surgery knew their surgeon before they operated on them. This is a very unusual circumstance. Hi, nice to meet you. Who the F are you? We're going to operate on your face. Excuse me? Bye-bye. So it's very unusual, and so we need to cover a lot of ground in a very short period of time. So at any rate, several hours later, Humpty Dumpty, we put you back together the best we could. I took a bunch of very...
What do you mean the best you could?
Well, trying to be humble here. So we put you back together. I took a bunch of photos that later served you well of some of the trauma and where things were open from the outside to the inside and things that shouldn't be where they are. And then began our journey. The real journey began after the fact, because while that horrific night occurred, it was finite. The aftermath of a trauma, the emotional, the psychological, the hand-holding, the pain, the swelling, the all of that it takes to get you from the day that we saw you in the ER to, hi, I'm at a party and no one knows what happened to me. That's a long journey. And, that's when we became friends, because at that point, there's a lot of sharing that occurs. And it's interesting because how you manage it is how most people manage it, which is you didn't want to see it. It's interesting because the overwhelming majority of patients who undergo facial trauma of the extent that you have don't want to look at themselves for quite some time. which is interesting because if you had a rhinoplasty, you take your cast off, right? You'd immediately want to
Immediately, you
look.
want to see it.
You're like, okay, I went from terrible to, I hope, fantastic. This is the reverse. And I remember you would cover it with tape.
Yeah, and
right?
bandages.
And bandages.
I didn't want to see it.
Even well after I said,
Well after.
listen, Asaf, it's good. You can take
Because the minute you take it off, first you need to face it. Good, bad, scars, whatever it is. I only remembered what happened in the gym. The nose is in pieces.
So it was interesting because how long did it take before you actually ever looked at your nose? It was...
Completely?
Yeah, like you went in the mirror and you sat there and you're like, aha.
It's been a while. I know that completely to take it off and show it to the world, 5-6 months.
Yeah, I was going to say it was on the order of several months.
Yes, I wasn't ready. So in one point I was ready to face myself. I think, I don't know, 3 months.
3 months, yeah.
But then I looked and I put it back. You said, you don't need it. You kept telling me you don't need it anymore. I said, no, it's no, I made a story in my head that it's not ready.
Well, but that's the process, and that's the grievance process of managing trauma, and that's the grievance process of you coming to grips with your immediate reality, because it wasn't something you get a chance to get ready for. You're going to have an amputation. We have to remove your toe. You're starting to get gangrene. This is like blink, and my life changed, and now I have to reverse get used to it. So we did all that, and here we are, right? This is now going on 15 years?
Yeah, 12, 15.
I think it's more than 12. Now I'm going to be...
What is numbers here?
Yeah.
We don't...
Many, many years.
Years.
So this is your story, your journey. But I would say that 99% of nose traumas are much milder. They're usually involving either a laceration, something happened to the skin, or there's a break in the bone. Commonly, the nose is swollen and it looks crooked, and patients are calling, and it's that type of nose trauma that most people are accustomed to. And that's kind of what I want to focus on in the second half, is through your holy shit, I can't imagine journey. Now I want to bring it to reality, because obviously when people call, they're also hysterical, even though it's a fraction of what happened to you. As I said earlier, I get a phone call maybe at least once a week. Hey, I have this nasal trauma. What do I do with it? The first thing is, when do we or when don't we operate? With regular traditional nasal trauma, basketball injury, I almost never operate. Why? Because initially when people are calling and like, oh my God, my nose looks terrible, you can't make any decision as far as that kind of nose, not your nose, for at least 72 hours. You have to put ice and ice and ice, because a lot of what looks jacked up is swelling. And only once the swelling has settled can you start to be like, oh, yeah, it doesn't look as bad. Okay, so what are we operating on? When you get smashed in the nose, your bones are usually turned into, like, we call it comminuted fractures. They're just broken a little bit, but they're staying in place. So we just usually tell you to just leave it alone and let everything heal. And 90% of nasal fractures, my nose is broken, heal on their own, you go live your life. Nothing has to be done. In a very, very small percentage, the dust settles 3-4 days and your nose is grossly crooked. Like, you're looking at your nose and you're like, wait, 4 days ago it was here and now it's like all the way to the left. And then when you run your finger in those areas, you can feel the bone is not the same. Those fractures need to be fixed within the first 2 weeks. What do? We take you back to the operating room. We put you to sleep for 5 minutes. We sedate you and we just push it back into place. There is no place, people are like, hey, can I get a rhinoplasty now? No. Everything's broken, it's shattered. So all we want to do with that type of procedure is try our best to get it more in the middle. And we do that just by using pressure and like setting of a arm or a leg. We're trying to set the bones without operating on them. Then we cast you. So really, that's really the only main procedure that we do. And that happens within the first 2 weeks. Why the first 2 weeks? I broke my nose a month ago. Can I have it operated on now? No, because those bones heal like that. Your arm takes 8 weeks. Your nose, 2 weeks, and it's healed. So you have to do something early, but you can't do something right away because it's too swollen to know, okay? The next question is, and the question that people ask is, all right, so I broke my nose, I did a nose job, or better yet, your instance. So your nose heals, 6 months, 8 months, 9 months go by. And while we did a good job, arguably a great job, your nose was not exactly the way it was before, right? There was a dent here and a little step off here and a little something here, right? So then you come to me, and with all of these things, the question is, what do we do now that the dust has settled? 9 to 12 months have gone by and my nose is healed, but it's not perfect. It's not good. It still has issues. So then the question is, do I go back and do a revision rhinoplasty, fix it by operating on it, or do I use filler and do a liquid rhinoplasty? And this is a very interesting topic because this is one area where I think fillers have done a remarkable job to make advancements. As a rhinoplasty expert, as a surgeon who does rhinoplasties, fillers have added for me something so magnificent I can't tell you. Because let's take your instance. Your nose healed, 12 months went by, way better than the night I met you, but not the way it was before the trauma, right? And you're like, can we fix this? It's good, but now you're coming to grips with the issues. If I went back into your nose and tried to reoperate on your nose, given that it was crushed and healed and this like that, the likelihood of me being able to make you a result that you would love, as I said to you, was very low. But with some filler, I'm able to just smoothen out some of the irregularities in such a finesse and refined way that I couldn't even done with surgery. And that's the option that we chose because I felt that would be the best thing for you. And it's something you do once every 3, 4 years. So filler is an amazing option for complicated noses that have issues where the reoperating on them could potentially lead to a worse outcome. Do you remember when we talked about that back in the day? You originally wanted to be operated on, yes?
I wanted, the magic spell.
You just wanted it to be done.
Yes,
I don't want it to come back
done. And then, when you say fillers, you're like, oh, okay, it's 3 years, doesn't matter. But it feels like you're carrying the trauma with you.
Sure.
Because again, you need to face it in 3 years and another 3 years. But it was magic.
Right?
Because you can target it exactly the things that I didn't like.
Yes. And I wouldn't have been able to do that surgically, by the way. Don't get me wrong. If I can fix it surgically, no matter how difficult it is, and be done with it, that's what I'm going to suggest to you because it's forever. But in many instances, especially traumas and revisions and complex noses with a ton of scar tissue, it is way easier to fix things with paste than to fix things with bricks, right?
Yes, and also, I think it also depends on the personality. Because when you say perfect, what is perfect? Like I could have come out of the second surgery and still will tell you, oh my God, but I don't like it.
For sure.
And I think for me, the fillers, the best solution.
Yeah, anyways, I don't really give you an option if the option doesn't exist. In other words, if I don't think that there's a high probability that the surgery will look better, it's not an option for you to pick. I just explained to you why you can't do revisional nose and why I suggest the filler option. If I think there are instances where the filler option is a terrible option, it's just not the right option. We got to operate on this. It's not going to go away with a filler. It needs to be corrected surgically. But when the right patient is selected and done correctly. Now, caution to all of the people listening. Well, let me run out and get nose filler. Now, the flip side is nose filler has to be done so carefully because the nose is a delicate structure and there are blood vessels in the nose that are linked to your eyes. And it's rare, but there are rare instances of blindness that occur from nose filler. And so you don't just go to your local spa where the girl injects your lips right? And you get your filler or whoever and just be like, hey, I'm here. You know, I had a nose job when I was 16. Can you fix my nose while you're here? I think that's a terrible idea. Noses should be reserved for experts to fill, not the same way you do your cheeks and lips and whatnot. So now that you're out this many years, right, do you still think about your nose, or is it safe to say that the physical, mental aspects of your trauma are gone?
I think it's gone. Look, I remember,
Sure,
and it's not going to go away. But I love what I see.
So when you look in the mirror, you don't see, oh wow, that's still fucked up, or wow, that
no. And also, we get used to our face.
Sure,
So it's been a moment. I love what I see. When I tell you every time you saved my life, look, I wasn't about to die.
Yeah.
But my life is my face because of what I do and who I am. And you did save my life, because when I wake up in the morning and look at the mirror, I'm happy.
Yeah.
And
it's
I
very
start
powerful.
my day
Yeah.
and happy, and I love what I see.
Yeah, and if you think about it, which you obviously have because you have great perspective, if let's say it didn't work out well and there was some very significant sequelae, while you would eventually get used to it, like we get used to being blind, we get used to being deaf, we get used to missing a limb, but it doesn't mean that we get used to it. It would have forever created a dark cloud, which would have been a shame, because for someone like, it's a shame for everyone, but in you, it would have been really unfortunate, because so much of who you are, the persona that you have is such an extroverted person. For sure, it would have castrated your personality.
100%. I wouldn't stop also looking at it.
Yeah.
But
it would have affected everybody, but some people it would have been the end.
But I do have a question.
Yes.
Do I need fillers? No, for real. The last time you did it was 3 years ago.
No, I was actually just going to say it looks fantastic.
For real? Because you kept saying 3-4 years.
Listen,
the last time you did it.
That's a great question. That's a great comment. So people get fillers in their lips. 4 months, 5 months. People get fillers in their cheeks. 8 months, 9 months. Same filler, by the way. Same filler, same face. So filler in the nose can last 5 years, 8 years, 12 years. No one knows why, but in certain areas, the blood supply and the breakdown of the filler is much more rapid. In certain areas, it's much less. And then there's the building effect. In other words, at first when we did it, it was like 2 years later we did it. Then it was 3 years later. Then it was maybe 7 years later. Then there may be never another time you need to do it, even though it's absorbable. Because there's a certain walling off effect that happens, and it doesn't get any, your body breaks this filler down. So
4 years. Yeah. Almost 4 years.
Yeah.
Since you did it.
No, I would tell you. First thing I'd say,
nothing?
No, nothing. It looks right on the money.
A little bit here?
No. Honestly, genuinely, I would say very, very good.
And you will tell me that you're always honest, and you're always going to tell me.
Unfortunately.
Sometimes I'm afraid to ask you the question because you're going to tell me only the truth.
No. I would tell you because I think it's necessary for you to know. Why would I? If I had some spinach on my tooth, you better tell me.
I would not.
Yeah,
because I would love to see you talking with the spinach.
Yeah, see, but that's I'm like, Asaf, let me get this out.
I would like, smile. You have a beautiful smile with the spinach.
Yeah, no, I would have picked it out for you. Any rate, as always, it's a pleasure. Every time we see each other and discuss this journey, it shows you, for me, that the job is hard. It's a hard job. It's a very stressful job. But there's nothing that I could think of, shy of police, fire department, just a few things that you get to do where you make this kind of connection or have the potential to make this kind of connection with so many people. And it's, it's the price you pay for the job, and it's well worth it because, we've been able to have an amazing friendship as a result of it. You don't obviously become friends with every one of your patients, but it's nothing can connect to people more than this. Faster.
And I say it all the time, how grateful I am that you're part of my journey and what you did to me. And from the moment, as I say, I saw this, the Persian face. I for real.
I love it.
It's For some people, it will feel minor. Oh, I fixed your nose. No, you fixed my life.
Yeah,
you fixed my life. You gave me a future. You gave me you gave me my livelihood back, and thank you.
Yeah, you're very welcome. It was and is a pleasure. All right, guys, that wraps up a fantastic episode.
Was it?
I mean, it was to me. I don't know about them. I don't really care. I loved it. So, as always, two parting concepts. One, if you like the show, you find it to be valuable, share it with the people you love. You have no idea who's on their way to a strip mall in Miami to get surgery done or going to Venezuela. Share this podcast. The information will be invaluable. The second is if you like the show and you listen and you think it's fun or whatever, write something nice. Go leave a review. Write something positive. The people who come on Sunday and spend hours putting this together, they will be grateful, as will I. And furthermore, it increases and elevates the ranking of our podcast, which then allows more people to hear it. So we're always grateful that you tune in. Until next week, I'm your host, Dr. Rady Rahban.